Hi, Dr. Scott here, and I want to talk to you about stem cell therapy, and in particular, where do we get the stem cells from? This is one of the most important factors that will determine if your stem cell therapy works or if it doesn't work. And what I mean by working is long-term regenerative process, not just short-term pain relief. So this is key. I'm going to cover them. Now, the source of the stem cell, there's two factors of why this is important. Number one is how many stem cells are you putting in? And how old are they? And when we say stem cells, what we really are looking for is mesenchymal cells or mesenchymal cells. We call them MSCs for short, okay? There's the classification of stem cells. There's a lot of different kind of stem cells, but the ones that are doing the regeneration is mesenchymal cells. So that's what you care about, and that's what I care about, okay? So the older we get, the less stem cells or mesenchymal cells that we have, and the ones we do have, they're old and they're tired. So they're the same age as we are. So if you're in your teens and you want to get stem cell therapy, you probably could do like your own stem cells, like bone marrow or fat. Okay, but if you're not in your teens, which most people aren't, they're like in the 60s, 70s, 80s, you're going to want a young cell and lots of them. Okay, so let's talk about the different sources of stem cells. Number one is embryonic stem cells. You will never get that in the United States. It is illegal, so don't even worry about that. There are ethical issues with embryos, and they were having issues with them anyway, so they're not a good viable product. You couldn't get them if you wanted to. They're illegal. The next two are what they call autologous stem cells. Now these are the ones which mean you're getting them from your own cells. The first one is bone marrow, where they go right through the hip. Okay, actually go right, your hip's over here, but they go right into the hip and pull out bone marrow, and then they spin it down, they get your stem cells out of it. Same with fat, they just go in your fat and process it that way to get the stem cells. Again, these work, like actually bone marrow is probably the most utilized method of getting stem cells from. Been done the longest, and it really did pave the way for procedures that we have today. But here's what I'll say with bone marrow and fat. It's kind of outdated now. I like to reference it like a black and white television. When black and white TV came out, it was great, right? But once color and high definition and 4K, 5K, if you're in the market of looking for a TV right now, I'm sure you're not going to be looking to do a black and white television. It works, but it's not as good as a high definition television. And we'll talk about what the high definition stem cells is, okay? But that's bone and fat. Now there's also amniotic fluid some doctors use, and cord blood that they use. Here's a problem with those products. There are no mesenchymal cells in either one of those. Okay, they're just not. So you don't want to use those products. Lastly is umbilical cord. That's the one I'm going to recommend. And the type of umbilical cord and where you want to get it is Wharton's jelly. Okay, that's where you want to use Wharton's jelly. Now I'm going to I'm going to show you here on a graph that shows you how many stem cells you get from each procedure. Okay, I'll throw it up here so you can see it, and you can see clearly that bone marrow and fat, you're getting some cells. Now remember that high number, you're not going to get the most if you're in your 60s or 70s. You're not going to be on the high end, you're going to be on the low end, right? But you can clearly see that Wharton's jelly is the most abundant and the most dense of mesenchymal cells, and that's why we need to be using those. So Wharton's jelly, there's one lab that can provide third-party testing on that the cells are viable and how many you're getting. So there's just so many labs out there that just aren't giving the data to doctors or professionals or practitioners, and sometimes they just don't know, and they're going off the advice of the representatives. But I'll tell you, the source is super, super duper important, and you want to make sure it's verified by third-party testing. If not, you will not get as good as procedure. So that covers the sources of stem cells. I can tell you that our clinic, we have the best source. I really feel we can give you the best stem cell therapy possible in the United States. And our percentages are fantastic. About 93% of our patients are getting a remarkable success. It's been amazing. I've personally had stem cells in my back and my knee, and it's been incredible. So with that, we'll talk about how to look for if someone's giving you data about stem cells, this is how you're going to know what to look for.